Our data are dated back in 2017 when we did a population representative study in the prefecture of Attica, which basically covers half of the Greek population. At that time, the e-cigarette use rate was 5%, and we only examined e-cigarette use because heated tobacco products were just introduced into the market. There was not enough time for adoption by the population. So basically, the only harm reduction product that we had was electronic cigarettes. 5% rate, we found that in the prefecture, there were 150,000 people who had quit smoking and were using electronic cigarettes, quite large numbers. We also found for the first time that the smoking rates were less than 40%. There were 33% at that time. Electronic cigarettes were the most popular smoking cessation aid used by the population. There were a lot of failures. I mean, a lot of current smokers who tried electronic cigarettes but were not using electronic cigarettes anymore. Again, it was a time where products were not so refined as they are today. Unfortunately, the problem is that we cannot find the funding to re-examine these issues because, as you understand, you need to monitor the situation in the population at least on an annual basis. And unfortunately, we haven't done that. We focused on looking at the link between harm reduction products and smoking. So examine the smoking patterns, past and current, of harm reduction product users, in that case, as I said, electronic cigarette users. This is something that needs to be repeated. It needs to be repeated because that's the only way of looking at the evolution and looking also at future trends. You can't identify trends by just looking at the evidence at one time point only. And this is the message. We need to focus not only on just reporting smoking rates and harm reduction product use rates. That's useless, basically. We need to study the link between the two. We need to study what's the association and what are the interchanges between different behaviors with the introduction of these harm reduction products. Unfortunately, we are lacking data on that. And when you don't have the data, you can't make definitive conclusions and you can't make definitive considerations and recommendations. But we are seeing, and Greece is a country where harm reduction use is visible on the streets. You see people using products. It's quite easy to find products in the market. We don't have severe restrictions like many other countries. We don't have bans. We just need to document not only the use, but most importantly, patterns of use and current and former smoking habits of these users.